Hi everyone, it's Michelle Carroll, founder and CEO of Lexcura Summit Medical Legal Consulting. Today we're diving into an issue that is growing louder behind the scenes but still hasn't truly hit the national spotlight. We are heading toward a moment of enormous tension in American healthcare, a moment where affordability, access, and system stability collide, and that moment is coming in 2026. That's when the expanded Affordable Care Act tax credits are set to expire. These credits are not just financial assistance, they're the backbone of affordability for millions of Americans. Their loss would create a ripple effect that touches families, clinicians, hospitals, insurers, and legal professionals, all at the same time. But even as we talk about this looming crisis, it's just as important to discuss the steps we can take now to prevent disaster later. So let's walk through what's at stake, why this matters, and how we can prepare. To understand the breaking point, we need to start with what the ACA tax credits actually do. They aren't just discounts, they are the mechanism that keeps premiums within reach for millions of everyday people. The majority of those who benefit aren't low income, they're freelancers, small business owners, early retirees, part time workers, caregivers, gig workers, people who make too much for Medicaid but nowhere near enough to pay full premium prices. Right now, these credits cushion families from the true cost of insurance, but once they expire, that cushion disappears overnight. And the moment it disappears, the pressure shifts directly onto households, hospitals, and the system as a whole. The first and most immediate impact will be felt by families. Someone paying around $300 or $400 a month for a plan today could suddenly see that same plan jump to more than $1,200. For many households, that's not an inconvenience, it's an impossibility. And when premiums spike like that, healthier individuals tend to drop coverage first, not because they want to, but because they feel they can take the risk. When those individuals leave the marketplace, the insurance pool becomes sicker, risk increases, and premiums rise even more for those who remain. That's when the spiral begins. Once it starts, it's very difficult to slow down. But the financial shock is only the beginning. Once people lose coverage, the behavioral ripple begins almost immediately. They stop scheduling preventive care, they delay checkups, they try to stretch medications a little longer. They avoid specialists altogether unless something becomes unbearable. And when care becomes reactive instead of proactive, we see a shift in clinical acuity. That means more uncontrolled diabetes, more strokes, more late stage cancers, more heart complications, all conditions that could have been managed or even prevented if people had stayed connected to the system. This puts emergency departments back into the role of primary care providers and pushes hospitals to manage escalating levels of uncompensated care. For clinicians already stretched thin, this shift doesn't just increase workload, it increases emotional burnout and risk exposure. From a medical legal standpoint, this shift creates new complexities. When patients can't afford follow up care, can't refill medications, or can't access specialists, those gaps often appear in documentation. Suddenly, attorneys and medical legal experts are evaluating cases with multiple overlapping factors: delayed access, untreated conditions, missed diagnostics, and system level barriers. Determining causation becomes more challenging, cases become more nuanced, and patterns related to affordability begin appearing across patient populations. This isn't just about individual negligence, it's about system strain intersecting with clinical decision making. And that intersection will increasingly shape litigation, risk assessments, and standards of care. The impact doesn't stop with patients or the legal ecosystem. It spreads into hospital viability, insurance market stability, and community health. When millions lose coverage, emergency rooms become more crowded, rural hospitals lose even more revenue, and insurers reevaluate their participation in certain markets. Costs rise across the board because delayed care is always more expensive than early intervention. This pressure doesn't stay in one place, it moves through every part of the healthcare system, from admission rates to staffing levels to malpractice risk. And because all of these elements are interconnected, the system becomes more fragile, not less. Now, the good news: this trajectory is not locked in. We still have time to prevent a full scale crisis, and several strategies are already emerging as potential lifelines. Extending or restructuring the tax credits is one of the most straightforward ways to maintain stability. Keeping coverage affordable is the fastest way to prevent the premium shockwave and protect the insurance pool. We're also seeing momentum around strengthening primary and preventive care access, which can dramatically reduce long term costs. As more employers explore innovative benefit structures, more families are finding paths to coverage outside of traditional models. Supporting rural and community health systems is becoming a national priority because when those hospitals collapse, the surrounding region loses access to care altogether. And across the industry, there's an increasing push to help individuals navigate insurance more effectively because when people understand their benefits, they use them earlier. And that protects both patients and systems. Preventing disaster requires alignment, communication, and shared responsibility, not isolated efforts. But with coordinated action, it is possible. As 2026 approaches, we are standing at a crossroads. The loss of ACA tax credits has the potential to reshape healthcare in profound ways for patients, for providers, for hospitals, and for the legal landscape. But this isn't a conversation about doom. It's a conversation about awareness, preparation, and the power of strategic action. We can prevent disaster. We can protect families. We can stabilize the marketplace. We can reduce risk and preserve access. But only if we start planning now. If your firm, organization, or healthcare system wants deeper insight into how these changes will influence litigation, risk exposure, or clinical safety, Lexcura Summit is here to support you with the expertise and clarity needed to navigate an evolving healthcare future. Thank you for joining me today. Until next time, stay informed, stay proactive, and let's work together to protect the future of American healthcare.